Hey everybody. Hope you all had good holiday season. I think have we seen each other since then?
We have not we have not met since December.
Time flies.
Does indeed. It does
Happy
indeed.
New
And
Year.
hopefully we were having fun while it was flying too.
Right.
I'm looking. I think we might need one more before we have quorum. But you correct me
Yes.
if I'm, is that correct?
Yeah, yeah, I think you're right.
I think I counted four.
Vice Chair Ray.
Oh, there
I
he is. Okay.
Yeah,
I
I
think
haven't
we're good.
received
Everybody,
anything.
Hey, Gene, how are you? Dr. Ray?
doing great, Roger. Hope you are as well.
Doing well, doing well. Hi, Mr. Gregorio. Good to see you all. I'm going to call this our February meeting of the Durham County Board of Health to order at 5 p.m. on um, Valentine's Eve, February the 13th. Um, Before I begin with the agenda, I did want to take a moment to recognize a few folks. And this may be a little out of order, but we're going to do a vote, so I wanted to do this first. Mr. Joshua Brown has been reappointed to the board. I'm not sure if he's on the call yet, but also I wanted to recognize Dr. Pam Silberman, who is new to the board. And if she's here, I will give her a few seconds to introduce herself very quickly.
I don't
She's
think
n-
she's showed up yet.
she's not here yet. Okay, we'll move on. But
I
they
think
are
she
new.
just logged
There
in.
she is, Dr. Silverman. How are you?
I'm
Oh,
okay. Sorry for being late.
no worries, no worries. I just wanted to welcome you to the Durham County Board of Health. Did you want to take a moment to and let me not forget Commissioner Valentine, who's also new to the board, to welcome you to and give you an opportunity to say just a couple of words to the rest of the board.
Sure. Commissioner Valentine, you want to go first?
No, you must.
Okay. So, hi, everyone. I'm Pam Silberman. I am formerly a professor in the Department of Health Policy and Management at the School of Public Health. I've been retired since 2023. I used to run the DRPH program that Rod just graduated from not too long ago. So I have a connection with him there and from the Kate B. Reynolds Charitable Trust Board. And prior to working at the School of Public Health, I used to be the president of the North Carolina Institute of Medicine. So that's my background and been a long
Awesome.
time Durham resident.
Awesome. Thank you again. Welcome, Commissioner Valentine.
Yes, Dr. McDougall, thank you so much. And so I come to you as a sitting professor at North Carolina Central School of Law, where I'm the director and supervising attorney of the Veterans Law Program, and a former assistant professor in the social work department. So I have experience in both law and social work. And so, the people were so kind and generous to elect me for a term on the county commission. And so I'm here to serve, and I look forward to the work that we're going to do together. So thank you again.
Thank you. Thank you. And we don't want to forget about our old friend, not so old, but longtime friend, Joshua Brown, who was recently reappointed to the board. Joshua will give you the same courtesy to say hello and give a brief synopsis of your bio.
Oh, thank you, sir. Yeah, absolutely. I'm glad to serve my third and final term with the board here. I joined back in July of 2020, and my experience, I'm currently a finance manager at Humana. I went to UNC for my master's degree in health informatics, and been a Durham resident since about 2018.
Awesome. Awesome. Well, thank you. And again, welcome back to Josh and welcome to Commissioner Valentine and Dr. Silberman. All right. So we have hopefully had an opportunity to review the agenda. I will entertain a motion at this time to accept the agenda or amend the agenda as necessary.
Motion to accept.
All right. Is there a second?
Second.
All right, very good. It's been moved and properly seconded. If we don't have any unreadiness, we are ready for the vote.
Okay, Chair McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio, Dr. Jackson, Dr. Miller, Dr. Orto,
Yes.
Ms. Silberman,
Yes.
Commissioner Valentine.
Yes.
Thank you.
Thank you. Again, hopefully you've had an opportunity to review the minutes from the December meeting. Assuming that you have, we'll entertain a motion at this time to accept the minutes from the previous meeting.
So moved.
Second.
All right, it's been moved and properly seconded. If there's no debate, we're ready for the question, Donna.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio,
Yes.
Dr. Jackson, Dr. Miller, Dr. Orto,
Yes.
Ms. Silberman,
Yes.
Commissioner Valentine.
Yes.
Thank you.
Awesome. Donna, do we have anyone registered for public comments for this evening?
No, we don't.
Very good. All right, so at this time, we'll go to the next agenda item, which is our staff and program recognition. So we'll give way to our director, Dr. Rod Jenkins.
Thank you so much, Dr. McDougall. And first and foremost, I'd like to personally extend a warm welcome back to Mr. Brown. Thank you for your service. He's been a fantastic board member, very faithful, very one that shows up. So we thank you so much for your participation. And warmly welcome Pam Silberman and Commissioner Valentine. As I've said privately, you're joining probably one of the greatest boards in North Carolina. The Board of Health, they get it done and they get it done efficiently. So we hope to continue that. As the year has started, just two individuals that are near and dear to my heart and near and dear to the work that we do here at Public Health in Durham, and that's my two deputies. I'd like to just publicly recognize Liz Stevens and Christian Patterson for the awesome work that they do. Some of you know that I am the president of the Association of Local Health Directors for this year, and that has taken me away from the office not too much, but I just want to publicly thank them for their professionalism and for all the work that they do while I'm out, really advocating for public health throughout North Carolina. I'm proud to say that I chose wisely with two strong females to be able to lead the pack, and they do an excellent job with care and compassion and a lot of professionalism. But Dr. McDougall, just wanted to recognize them for all that they do and who they are, and just let them know that I'm forever grateful for all of their service. Back to you, sir.
Thank you. Very appropriate, that recognition, and I will second that kudos. We'll move on with the agenda. We have our administrative reports, the first of which is our fiscal year 24-25 quarter 2 fiscal overview by Micah Gwendon.
Yes, thank you. Good evening,
welcome.
everybody. Happy Valentine's Eve, as Dr. McDougall says to everybody. I'm going to share my screen. Please let me know if you can see my presentation.
Yes.
Awesome.
Yes.
Okay, great. Okay, so as Dr. McDougall said, tonight I'm going to be sharing our fiscal update through Q2 of the current fiscal year 24-25. As I always share with you, we started our fiscal year with a budget of $25,573,054. That's the number that should not ever change in my presentation throughout the year. In Q1 and Q2, we had budget amendments and rollover netting a positive $1,244,250. Q2 budget amendments included several state grants, as usual, the Health Department of the Year Award, as well as the Ann Wolf Award. We had a dine realignment and an increase to the WellPath contract for our jail health program. This brings our current budget to $26,817,304. Our expense budget is $38.17 million. This number excludes the benefits that the county keeps outside of the general fund. 38.17 is a 6% increase from where we started the year. And to date, we've spent $16,839,712, or 45% of our general fund expense budget. Personnel costs, as always, including salary, FICA and retirement, and miscellaneous contract services, are the general ledger line items at the top of our spending list at the end of Q2. This sales Pareto chart has those two categories making up 94% of our spending in the first 2 quarters. Additionally, and perhaps a bit more interestingly, I wanted to share with you all that we have purchased $9,976 worth of blood pressure cuffs for our family planning patients, $2,403 worth of bike repair stands in partnership with Durham Parks and Rec with some Duke Endowment funds, $4,662 worth of workbooks and learning materials for our parenting groups, $71,153 on vaccines for various clinics, and $2,442 on condoms for the STI clinic in Q2. In terms of revenue, the Department of Public Health has brought in $4,210,752 in revenue as of Q2, making up 37% of the revenue budget. Medicaid continues as the highest revenue source for the department, totaling $1,994,910.61, and grant revenue totals $1,789,714.67. Those two revenue sources make up 90% of our department's overall revenue, and our service fees at the end of Q2 are coming in at $252,439. Our department has been granted $923,866 of the county's opioid settlement funds for the current fiscal year for 3 projects. At the end of Q2, we have spent 12% of our budgeted expenses for the year. We've hit our stride a bit more in Q2 as our past month in spending is close to the whole total for Q1. So we're headed in a good direction. And later this evening, Jason Smith is going to be going through a lot more detail about these 3 projects, but this is the quick and dirty in terms of the funding for the opioid projects. As always, I'm appreciative of the board's attention to the fiscal health of our agency, and I'm happy to take any questions you all may have at this time.
Mike, a quick question. If you go back to the revenue slide, yes, this one, perfect. So this may be a larger question that doesn't necessarily have an answer today, but obviously in recent news, Medicaid funding and government funding for grants are certainly the status of which is questionable. Has the department started or done any analysis, particularly on the grant revenues portion of what may be impacted by any upcoming cuts to funding?
Yeah, thank you so much for that question. We've been working with the county finance department, and Dr. Jenkins has also been in regular touch with folks at the state, and there's levels of analysis happening all across the board. What we've done at this point is really identify all of the grants that we have and the different CFDA numbers that are associated with those, basically the source that they're coming from the feds. And, essentially, to put it lightly, the list of issues of concern is lengthy and intersects in many places with our work. So we're, and then of course, Medicaid, is its whole other thing. But at this point, we just are doing that analysis and kind of standing at the ready to be able to pivot however we need to, but definitely in communication with powers that be, and everybody is kind of poised to take action if needed.
Great, thank you very much.
Yeah, thanks for that question.
Great question, Dr. Ray. Do we have any other questions from Micah? Seeing none, we will thank you again, Micah, for your awesome presentation, very informative. And we will continue on with the agenda. We have our next presentation, Savannah Carrico, I hope I pronounced that properly, will give us a 2023 Youth Risk Behavior Survey presentation. Savannah.
It would help if I take myself off mute. All right. Could I get a confirmation that you can see my screen in full screen?
Yep.
Yes.
Awesome.
We can see it.
Great. Well, my name is Savannah Carrico. I am the public health epidemiologist for Durham County, and I've been in this position for about 3.5 years, and this is my second presentation on the Youth Risk Behavior Survey, which we affectionately call the YRBS. And I'm excited to tell you guys a little bit more about the results of the 2023 survey. So this survey is actually a CDC survey, and it's done every 2 years. The most recent survey was done in spring 2023. CDC selects 2/3 of the questions, and state and local government can also contribute to the remaining third. Durham County is an oversampled county, which means that we get over 2,000 middle and high schoolers participating in the survey. It covers several topics, which I'll get into. And I just want to mention the delay between the report and the actual survey. So it actually goes to CDC first, and they analyze the data and run their reports. It then leaves and goes to the state of North Carolina. And then it comes to us at the local level, and that is when we create our YRBS survey report. So these are some of the topics that I'm going to cover. I know it's a lot. I'm going to try to move quickly. I should be able to get you guys out by about 9 p.m., I think. But anyway, so this survey covers bullying, mental health, to nutrition, and personal health. I wanted to point out the bottom 3 in blue. These are new sections that we've added in 2021, and they also appear in the 2023 survey. And that is a deeper dive into LGBTQ+ mental health, as well as some questions on disability and school support as well. So like I mentioned, Durham County is an oversampled county, so all eligible middle and high schoolers were able to participate in 2023. Like I mentioned, it was administered in the spring, and it was conducted in classrooms, but it was conducted electronically. So I'm going to get into some demographics here. You'll see the racial demographics of middle and high schoolers. And they're not too different. And I wanted to mention too that the data that is in this survey has been weighted, which means that it is a representative sample of Durham Public Schools students. I wanted to also point out that it was evenly distributed among 6th, 7th, and 8th graders in terms of participation. However, high school students, 9th graders were a little bit overrepresented. And gender was equal for both middle and high school students, so it was about 50-50. I did want to point out some racial inequities because this is such a important topic in this day and age. I know last year we hit the 70th anniversary of the 1954 case of integrating schools, and we've come a long way from that, but there is still some discrimination that occurs in the education system as an institution. So there were some questions about discrimination on the survey this year. So 1 in 4 high school students reported feeling discriminated against based on their race and ethnicity, and 1 in 3 middle schoolers felt the same. And this is likely due directly to toxic stress, which can accumulate at an early age. And, daily barrage of discrimination in subtle, indirect, or direct ways, interpersonal or institutional, contribute also to this toxic stress. So already these students of color are already facing barriers than their white peers. High school students were asked if they were treated badly or unfairly because of their race or ethnicity, and they said sometimes, most of the time, or always. All right, looking at bullying. So this is bullying at school and cyberbullying. I want to point out the green bars on the right, that is middle school bullying, and the blue bars on the left are high school, and you can see the drastic difference in them. And you can see that in both middle and high schoolers, bullying at school was more common. And this is the discrepancy, or the differences are showing that twice the amount of middle school students reported being bullied for their sexuality than high school students. That was also analyzed in the report. And over half of middle school students reported seeing others bullied at their school. There's also a gender difference, with girls and boys being about equally likely to be bullied, but boys tend to bully physically, whereas girls tend to bully in more subtle and hard to identify ways. Moving on to disability. So we're looking at a couple questions here. So there was no major difference between middle and high school students when it comes to the questions regarding disabilities. The question that had the most than all the other questions was having a learning disability, and they described that as having a learning, remembering, or concentrating difficulty due to a disability. So mental health, I do want to say ahead of this, the next 2 slides are going to be dealing with suicide. I want to just put that out there in case you need to step away from your computer or put it on mute, whatever you need to do in the next couple of slides. I will try to get through them as quickly as I can while also making succinct points. So this slide is showing symptoms of depression according to the American Psychiatric Association. 1 in 5 middle schoolers and 1 in 4 high schoolers reported experiencing symptoms of depression. Middle and high school girls reported sometimes, most of the time, or always having bad days in the past 30 days, more often than boys. So there's a difference there. Studies have shown that girls are more likely to internalize their distress, and they feel pressure on social media and among their peers to have a picture perfect life. And, articles are coming out now that social media plays a big factor in academic success, as it perpetuates, it can perpetuate isolation and bullying and false information. So here we're looking at high school suicide. So you can see there are some racial disparities here. I'll point out a few. So Black or African American students and students that identified as multiple races and Hispanic or Latino were more likely to attempt suicide than consider or make a plan. You can see the drastic difference between white and their students of color peers. Whereas white students are more likely to consider suicide than make a plan or even attempt suicide. So what that looks like is 25% of middle schoolers and 17% of high school students reported considering suicide. Black or African American students, studies have shown, remain the most at risk for teen suicide. And again, as I mentioned, this is directly due to the toxic stress and racism they experience, likely on a daily basis. And then it also gives us a little bit of an insight into adverse childhood events, or ACEs, which can contribute to suicidal ideation among, any student, but children of color are often overrepresented in this population. Here is the section on LGBTQ plus mental health. It's similar to what we found last year. 72% of students identified as heterosexual, both in 2021 and 2023. Stigma and negative portrayals in the media make it difficult for LGBTQ plus individuals, especially children, to seek help and be heard and respected while seeking help. And you can see there's a peak there for bisexual students compared to their gay or lesbian peers, where we see considering suicide being the most common and about equal for made a suicide plan and attempted suicide. This is due to many reasons. There's often associated with this is biphobia in the erasure of bi culture and bisexuality because of a stigma that exists, that they're often disloyal to their partners because they're attracted to both sexes, or they are lying because there's no possible way they could be attracted to both sexes. So I just wanted to highlight that because we do see that reflected in the data here. All right, so I'm done with the mental health slides. If anybody else would like to hop back on, I'll give you a chance to. We'll be talking about nutrition here, and this is an interesting graph. I think you can see more middle schoolers eat breakfast every day more than high school students, and then we see the opposite for students that did not eat breakfast any day in the past week, with high school students being more likely to skip breakfast every day than middle school students. So 1 in 5 high schoolers reported never eating breakfast in the past week, and 1 in 4 students reported eating breakfast every day of the week. So it's kind of a bimodal graph here. Middle schoolers were 24% more likely to eat breakfast every day other than high schoolers. And children of color are often more food insecure than their white peers due to a lack of grocery stores carrying healthy food in their area, which is due to longstanding systemic racism and housing. But I do want to highlight that Durham Public Schools now offers free breakfast for any student. Personal health, this is a slide on students getting the appropriate amount of sleep, which CDC recommends for students this age to get at least 8 hours of sleep. The middle school responses in green are shifted slightly to the right, which indicates they're getting more sleep than high schoolers, which are skewed towards the left, which indicates they get less sleep. Personal safety is another section that I think is pretty important, especially in this day and age. So this chart here is showing whether or not students experienced violence in their neighborhood, and there wasn't a distinct difference between high school and middle schoolers, but it was about 1 in 5, 1 in 4 students that had witnessed violence in their neighborhood. There was another question about skipping school in the past 30 days. 1 in 5 high schoolers did report skipping school for at least one day. The reasons that students are skipping school, according to a couple of studies, are school shootings, bullying, and anxiety. And then this particular survey, the 2023 one, did not ask any questions on gang activity, but that was in previous youth risk behavior reports. So unfortunately, there's no comparison here. And neighborhood violence is a social determinant of health that can identify inequities and violent crime in communities. All right, we're getting there, guys. Physical activity. In the past 7 days, on how many days did you get 60 or more minutes of physical activity, which is CDC's recommendation for students this age? Again, we're seeing one of those weird bimodal curves, and where we see a peak of everyday exercising and a peak at 0 days exercising in the past week. We're seeing middle schoolers participating in exercise a little bit more than high schoolers, and high schoolers are not participating in exercise more than middle schoolers. School support. This is a great question that was also in the 2021 Youth Risk Behavior Survey about feeling, the student feeling like they belong at their school. So students feeling they belong at their school is a great indicator of what adverse childhood events or ACEs trends are occurring in real time. Middle and high school students are very similar in their responses, with more students reporting they strongly agree or agree that they feel they belong at their school rather than disagree or strongly disagree. And then another question that was asked was about teacher support and encouragement, and over 1 in 5 high school students reported they agree that their teachers give them support and encouragement. Sexual behavior, the chart here shows if you've ever had sexual intercourse. We can see that middle schoolers are way less likely than high school students to report ever having sexual intercourse. However, though it's rare or not as prevalent, 8th graders and males were more likely to ever have sex than their peers. Among high school students that are sexually active, 11th and 12th graders were more likely to use a condom during their last sexual intercourse experience. And high school boys were more likely to report ever having sexual intercourse than girls. All right, getting down to substance use, which is the last section here. Middle school is displayed here on the left. Alcohol is the most common substance that was reported among middle school students, followed by misusing prescription pain medicine and ever using marijuana. Middle school students are more likely to ever drink alcohol than any other substance. 18% of high schoolers reported drinking for at least 1 day out of the past 30. 17% of high schoolers reported using marijuana at least 1 time in the last 30 days. And there was a question about vaping marijuana, and that has increased and is one of the more common ways to consume marijuana. Because there is a belief that students that vape marijuana believe it is less dangerous than vaping tobacco. But obviously, that hasn't been shown in the literature. 12% of high schoolers reported misusing prescription drugs in the past 30 days. I want to point out, though, that cigarette use among middle and high schoolers has dropped down below 2%, which is great. However, 1 in 3 high schoolers reported ever trying a vape, and 16% of middle schoolers reported the same. And that is all I have for you. I'm happy to take questions now. I want to say that the 2023 Durham County Youth Risk Behavior Report will be published soon. You can find it at healthydurham.org, and we will be blasting that out for everybody to know when it does go online.
I see your hand, Dr. Silberman. We'll let you ask your question.
Sure. I actually have 2 questions, and thank you for the presentation. The first is I'm really surprised by the suicide data around heterosexuals versus LGBTQ community. I thought that the rate of suicide ideation was higher for the LGBTQ community than it is for heterosexuals, but that looked very different in your slide. Do you have any reason to explain that?
Yes, I do. So this is the suicidal ideation among all students. So that's why that chart shows that heterosexual students have more suicidal ideation, because it's a larger, exactly.
Okay,
exactly.
so it's not a rate, it's more like a pie chart.
Correct.
Okay, that makes sense to me. That totally makes sense. And then the other question I have for you is, since I haven't looked at the data in the past, so I'm not looking at trend data, was there anything that really struck out at you about being aberrant this time around than what we've seen in the past?
Could you explain that? a little bit more?
So we had the same thing in 2021, we had it in 2019, similar questions. We're not seeing a trend data, we're just seeing a point in time. So
Yes.
since you've seen the prior ones and I haven't, was there anything in this that sort of stood out and surprised you because it was so different from what we've seen in the past?
Yeah, actually, thank you for asking that question. I am currently working on a youth risk behavior survey trend analysis, where I've run a logistic regression to produce odds ratio, and it goes over in detail the changes from 2017 to 2023. And that should be published hopefully next month, and we'll alert everybody when that goes out. For this one, there weren't too many major discrepancies. Again, we're seeing mental health concerns increasing year to year. We're seeing more girls struggling with mental health, and that's been consistent. One thing that I think is very odd is in 2021 and in 2023, substance use seemed to go down, according to the students that are reporting that data. And I mean, the survey is anonymous and it's voluntary. So, students may not be reporting it accurately than they have in the past, or substances are changing. They're using different substances than alcohol and marijuana and tobacco that they cover. Did that answer your question?
It did, thank you.
Savannah, I had a question in the personal safety portion. You mentioned that there was no question on gang activity in this survey, but it was previously present maybe in 2021. Do you know can you tell the reason why it was maybe left off of the 2023 survey, and if there's plans to add it to the 2025 questionnaire?
Yeah, thank you for that question. So the questions do change every year, depending on really what the CDC is putting out. And in order to ask new questions, they do take some out. And I think, you have to keep in mind that this is a national survey. So it's going to across everywhere, and it may not be the biggest priority in some areas of the country. So that is one explanation for why the questions change. I don't know if it's going to be added in 2025 yet, but the survey is going to come out in this spring. So students will be able to take it, and then hopefully we'll get that data in 2026 and can examine it a little bit closer. But yeah, it is a little disappointing that the questions aren't necessarily consistent.
So am I to understand it that the CDC creates the entire questionnaire? I thought that at the beginning you said that 2/3 of the questions came from the CDC and 1/3 came from the local.
Right. So I'm sorry. Yeah. So again, CDC does design the survey, but I imagine what happened was they added another question and had to cut one. But I don't know the reasons why they do that behind those cuts and additions. But I'm happy to find out.
Okay. Yeah. Just with all the media that we hear about gun violence in Durham, certainly wanted to see what sort of effect that might be having on our children and influence maybe with gang violence. So, but okay, we'll wait and see.
Dr. McDougall, Dr.
Yes, sir.
Jackson had a question. She's been
Oh, I'm
patient.
sorry, Dr. Jackson. There you are.
Yes,
Go ahead.
hi.
Hi.
Savannah, thank you so much for taking such a deep dive into that data. I wanted to ask your thoughts on what could be done to advocate more for mental health resources for our young folks, as we see that, mental health and depression and self-harm are really prevalent. Do you think that there is a role to use this data to either advocate within the school system or within other governmental resources to try to solve it?
Yes, that is my hope for these reports. And they have been shared with Durham Public Schools. They review it and they initiate what they need to do on their end. I am also going to release infographics, one for middle school and one for high schoolers, to kind of have an executive summary, which should hopefully get the information out there in more of a bite-sized, easy to digest format, along with the trend report that'll be coming out. Another thing we did last year in August was we hosted youth listening sessions at the Emily K Center. And we had 2 high school groups and 1 middle school group. And we had a set of questions that we chose based off of the results of this survey. And we got some excellent feedback, some excellent quotes. You'll be seeing those in the report that's going to be coming out shortly. And that's another way that we really tried to advocate for these kids to be heard and use their voice and make it personal and visceral so that change can happen.
Thank you.
All right, I don't see any other hands up, so I will say thank you, Savannah, for a very, very informative presentation. We look forward to the data and the analysis for the coming year for this for 2025. But thank you so much.
Yeah, thank you.
Yeah. So we'll move on to our next agenda item, which is our opioid update. And we have Jason Smith coming to us to give a presentation on the opioid update. There he is.
All right, thank you so much, Chairman McDougall. I'm gonna go ahead and share my screen here. Are you guys able to see my screen? Not sure.
Yes, sir.
Okay, awesome. It's not showing up on my end. I'm sorry. Give me 1 second. I'm not sure what's going on my end. Anyway, no worries. All right, so we'll go ahead and get started with today's presentation. Sure why it's not showing up in this mode. You mind if I just reshare real quick, Chair McDougall?
Absolutely. Yeah, take your time.
Okay. Hopefully you guys can see my screen now. Again?
Not yet, Jason.
Not yet? Still struggling. Okay. All right. Let me share this here. All right. Hopefully we're ready to rock and roll now. Are we set?
We can see your screen now. Yes, sir.
Awesome. Thank you guys so much. All right. So thank you guys again. Once again, I'll be very brief as well. My name is Jason Smith, and I work for the Department of Public Health, and I'll just be giving the FY26 opioid settlement update, and we'll jump right in. And I just want to say thank you guys for the opportunity to be able to share this update. So just jumping in, as you guys can see, this is the Durham County payment schedule for the opioid settlement funds that we'll be receiving. So Durham County is receiving around $21.7 million in opioid settlement funds from 2022 to 38. So over a 16-year period, we'll be receiving these funds. You can kind of see in the chart the highlighted bar charts here and the funds that we've already received so far. And then also, if you guys look at the chart as well, you guys will also be able to see that this is a kind of a gradually decreasing over time. This wave, which really just speaks to and highlights the need for strategic planning to kind of help maximize these funds over the long term. And so just wanted to kind of preface and pre-frame our initiative before we get to the initiatives, just a kind of high level overview of the payment schedule for what's coming into Durham County. So here's some program highlights. I'll be sharing 4 current initiatives that we are currently working on. And there are 12 evidence-based strategies that are approved for this funding. And so we are actively in operation for 4 strategies. And so those 4 strategies will be collaborative strategic planning, harm reduction, which actually has 2 strategies inside that one, and then community linkage to care program, which is our recovery support strategy that we are covering. And then kind of the last initiative there will be data enhancement, and that's what I'll share in today's update today. So for the first strategy, the collaborative strategic planning strategy. This is going to be a strategy that we'll be engaged in. So this will be where we'll be going through a strategic planning process in which we will bring on an advisory committee. So in order to do this strategy here, we have to engage with diverse stakeholders across Durham County. And one of the reasons for that is even from the national level, is one of the big things with this funding is ensuring transparency. And so one of the things that we're doing to do that as we engage in this specific strategy is we'll be bringing on an advisory board. And so far we've had high interest in this board, this committee, if you will, to kind of help steer, strategize, and guide and also give recommendations for this funds. And so this will be the composition of this committee will be around 10 seats. And we'll leave a couple extra seats as well at the discretion of the boards as well. But they'll range from local officials, individuals from social services, public health, education, law enforcement, community stakeholders, individuals from marginalized communities, lived experiences, all those different types. So we'll have a very diverse group that'll sit on this committee. And currently where we are with this is we are under the development of the bylaws as well right now. That's getting finalized. And soon there will be an application that will be released widely to those. So hopefully we'll be able to fill these seats and get this process underway in the next month. So for the second initiative that we're working towards is we're currently expanding our harm reduction efforts. So our harm reduction efforts, they're parsed into 2 strategies, as you guys can see, our naloxone distribution and our syringe distribution. And so there are naloxone, and I'll kind of focus on naloxone first. Our naloxone is actually parsed into 3 channels. So we distribute naloxone in 3 different ways, and that's through community distribution and access points throughout the community. Vending machines are our vending machines, and then also within our pharmacy clinic. So those are the 3 distribution channels in which naloxone is being distributed at this point in time. There are more that we are looking at. One other major highlight is on August the 19th of last year, 2024, the Durham County Department of Public Health hired our inaugural harm reduction public health specialist, Morgan Culver, to coordinate Durham County's naloxone distribution and safer syringe program, and also related educational efforts. And so this is our first channel of our distribution. So Morgan's been kind of standing up on this and doing a lot of hard work with finding out all the access points and finding out the areas within Durham, and also the community partners that are needed to ensure naloxone distribution throughout our community. In terms of the educational efforts that Morgan has been doing, she's also conducted 4 trainings as well. And she's been doing this continuously. And so far, she has been able to reach 134 participants. And she does trainings on harm reduction philosophy, overdose prevention, and safer use practices. So far, we've done social services, the city of Durham, Durham Parks and Rec, and other CBOs as well. And just quickly, we'll look at the syringe distribution that we see that's coming out of our pharmacy here. We've, at this point so far, we've been able to distribute 990, a little under 1,000 syringes so far that's come out of our pharmacy. And also, we are also promoting safer use practices as well in that time. So let's go to the next channel of naloxone distribution. And that is going to be our vending machines. And so you'll see also the sheriff's office, which is where we do have another vending machine where naloxone is being dispersed out of. And then you also see in the green where the health department vending machine is being dispersed out of. I do have another chart that shows us a little bit better. It's not as wordy from this one. But this second channel, like I said, from the 2 here, from the sheriff's department, we have 190 naloxone kits or boxes that are being dispersed So it's around an average of about 9 kits per day. You can kind of see where we highlight some highs in terms of September and October. We had around about 50 kits that were dispersed during that time. In comparison to the health department, kind of a massive difference here. There has been 703 naloxone kits distributed. So with an average of 14 a day. So this is about a 270% increase, about 3.7 times the amount of output that's coming out of the health department. And so quite a bit that's happening there. And so in January 2025, just here recently, we dispersed 146 throughout the month. That seemed to be our peak at this point. I also would like to note that there are steps underway to expand Durham County's naloxone vending machines with plans to add 2 additional machines and what we consider to be overdose hotspots across Durham County. And this is just the chart that I was mentioning before. You guys can kind of just see the distributions throughout each month, as I just mentioned. And I'll just pause there just so you guys can kind of look at that a little bit. All right. And I'll move into the third channel of distribution for naloxone distribution, which is also going to be our pharmacy. So we have a total of 238 kits that were distributed. There are 2 doses in each kit. So that was 476 doses distributed during this time. That's about 30 kits per month. We've seen the highest distribution of these kits being distributed in August and September, averaging close to around 60 of these kits that were coming out. We did notice that there was a significant drop in distribution in October, and also December and January showed a slight increase, but February was rather low as well. So we are kind of monitoring these data points and really watching, seeing what's going on. All right, so I think that pretty much wraps up our naloxone distribution. Our third initiative is our community linkage to care program, which I'm sure many of you guys are very, very well familiar with. That this is a long-standing program. This is where we are strengthening connections to treatment, recovery, and mental health services to support those who are affected by the opioid use. So in Q1 and Q2 of this year, the peer support specialists reached 120 new program participants, which was a huge highlight. And so we provided them with information, support, resources, and also referrals as well. And so you can see a huge number there. There was 1,660 contacts with all program participants. We also were able to provide approximately 360 free Uber rides to assist participants with transportation, to treatment and other services as well, to ensure that there was no, to kind of lower the barriers as well, reduce barriers for those getting to those appointments. We conduct surveys for these individuals, and 100% of the participants who were interviewed said that they would recommend the program to family and to friends as well. One other point I would like to add is that there was a new analysis of Duke Hospital medical records that indicated that 44% fewer individuals experienced an overdose in the 12 months after enrolling in the 12 months within this with the CLC program compared to 12 months before enrolling. So such a significant impact that has been shown throughout this specific program as well. This is going to be just a breakdown of Q1 and Q2 for the data. And this actually breaks down those with substance use disorder or opioid use disorder. We typically find that we are servicing about 36% of those that come in with opioid use disorder specifically. So we were able to kind of pinpoint that out. And also I will add this one quote. We've got many quotes so far through this specific initiative, but there was one direct quote that said that from a participant that said, I would say that the peer supporter that I had helped save my life. And there have been a ton of testimonies that have come in to share what's happening across this program. In the last initiative, as I'm getting ready to wrap up here, we are working on a collaborative data agreement with the Office of Emergency Services, and we're trying to formalize this agreement that helps to share data across departments, specifically in response to overdose calls. which will help to target our overdose response efforts as a whole. This will help us when we are coordinating our overall overdose efforts across our initiatives. So we have overdose incident details, EMS response and medical disposition information, demographic information as well, risk factors, and then also social and economic factors as well. So we'll have all of that data, which will further out. So in further updates, I'll hopefully be able to share some more information around what we're seeing and what we're finding across Durham County as this continues to expand. And thank you for your time and attention to everyone here for allowing me to share some of these updates across our 4 initiatives. And I also just want to send a special thank you to Lacey Schofield. She manages the CLC program. John Paul Zitta for the helping with the data collection. Dennis Hamlet, you heard about the harm reduction. He is the manager there for that program. So shout outs to him. Marissa Mortaboy, Lindsay Bickersbach, Kristen Patterson, Morgan Culver, and Director Dr. Rod Jenkins. A little bit of a tongue twister there, but thank you for the collaboration for everyone and making it such an ease to work with everyone as well. Thank you, and that's all I have.
Well, I'll let Dr. Jackson, I see your hand. I'll let you have the first question.
Yes, thank you so much, Jason, for again diving into the data. My question is regarding the CLC program and potentially widening the net of folks who may be able to benefit from this. And I think that the partnership with the OES is great. And I wonder if, in addition to the emergency services, there could be some coordinated referrals from the emergency room. I don't know, is that happening, or is that kind of out of the scope of, because there are case managers in the hospital emergency departments as well who may be able to connect folks who are there for overdose and
Yeah, absolutely. So I think this is speak to your referral question. I think that we are receiving referrals from the ED. I do know that capacity is of the essence in terms of the peer support. So those numbers are based off of 2 to 3 peer support specialists that we currently have. And so I think that as we do potentially as that team, but as they would like to expand, that would also have to look at a capacity component as well. I will also call on Lindsay. She's a little more close to the ground as well, if she wants to answer that as well. I don't know if she's on here. I can't really see.
Yeah, happy to weigh in just to share that the origin of the community linkages to care program was actually with the idea that the emergency department was our starting point. It was also our starting point in the year 2020. So this is one of those places where COVID has a really long legacy of the impact. We didn't manage to actually get into the emergency department until 2023. And we've continued to see that transition and just getting a foothold and people knowing about the program are challenges, but it is the case that we are actively receiving referrals from the emergency department. And another place that we're getting a good amount of referrals is the 23-hour crisis facility at the Durham Recovery and Response Center. So definitely getting referrals in those channels. Just learning all the different ins and outs of healthcare referrals has certainly been one of the things that has taken a little extra effort in this particular launch and growth period.
Thank you. Thank you both.
Thank you. Mr. Gregorio, we'll recognize you.
Oh, thank you so much. A wonderful presentation, Program Manager Jason Smith. Can you remind me again, where are the current vending machines? And did you mention that there were also future plans to expand the vending machines?
Yes, so the current one is in the share, so within the detention center. There is one that's located there, and then there's also one that's located in the front entrance of the health department there on Main Street. So those are where the 2 vending machines are currently located.
And in terms of, I suppose, awareness, especially with communities that might be more, inclined to have overdoses. I mean, has there been any pushback in terms of, wanting to go to places that might have, authority, right? So you mentioned detention center or such. I mean, would it be possible to have or expand these vending machines in areas that are a little bit more benign, maybe in terms of public transport access, as such? Just really wanting to make sure that the community is very much aware, but then also open and feel safe to having access to the kits.
Absolutely. I think you make a great point as well. At this point in time, I haven't heard any type of kickback or anything like that in terms of from the community or any kind of low barriers. If anything, we've seen even a higher threshold of reception from the receipt of the kits and where it's located. I think that as we continuously build more awareness, I feel like the output is going to be even greater.
Well, great to hear that. Thank you so much.
Yep. I think there's someone else with their hand up.
There, Dr. Silberman.
It takes a while for the computer to recognize your hand, so thank you. Jason, I used to be on the Alliance Behavioral Health Board, so I'm just curious, what kind of coordination do we do around opioid use services with Alliance? And also, I don't know if they pay for peer support. I know Medicaid pays for peer support. So are there other peer support programs besides the ones that we run?
Good question. I am want to maybe punt this to Lindsay. Are you familiar with how our coordination is with Alliance at this point in time with the peer supports?
Yeah, I can share a little bit more. It doesn't mean I have all the answers, but there is definitely a mental health and treatment subcommittee of Durham joins together to save lives, the substance use task force in Durham, and there is some good coordination with Alliance happening in that group where DRRC and other folks who are providing substance use disorder treatment are actively conversing about how they're doing it. In terms of where else there are peer supports, I do know of one other facility that has peer support on their staffing arrangements, but in general, we saw that despite the fact that it was a billable service, that it wasn't something that any particular treatment facility was finding that it kind of logistically made sense, including RI when we approached them about potentially building this. So it was only when we were able to initially get state grant money and then opioid settlement money to support the work that we've actually found both the referral sources and the capacity for an institution that is able to provide the supervision and the billing and the other things. So there's not a lot of other peer support in Durham beyond this program, which is one of the reasons that the county has really pushed for some support in that way, because we know it enhances the other treatment resources. But I would say that there's always room for coordinating across organizations, and the mental health and treatment subcommittee is probably the best place that that's happening in Durham right now.
Thank you.
And Lindsay, I'll add too as well, as the upcoming advisory committee comes on board, which will encompass many individuals of interest within Durham County. One of the things that we'll be doing is asset mapping and really kind of looking at a more holistic perspective and bringing all of these voices to the table, especially individuals who have been around for years, to really kind of weigh in on our naloxone distribution, our peer support, who's doing what, how to better coordinate. That's kind of what that process is going to look like in the next couple of months. So,
Dr. Jackson, I see your hand. We'll recognize you.
Thank you. With regards to peer support, I had a question and I think I remember hearing about this, but that the formerly incarcerated transitions program is also including some opioid use disorder resources and services into their queue. Are you guys familiar with that, the program, or if they are actually, I guess if you have any linkages with them, but
yeah, I think that's a great point. I think you're referring to the FIT program, with Konisha Archer as well. We have not yet done any coordination with them as of yet. So that's something I would like to look into a bit more.
Thank you.
All right. I don't see any other hands up. So I'll again thank you, Jason, for an awesome presentation, very informative. And really all three of the presentations tonight were very timely and informative. And I want to thank the board for your thought-provoking questions as well. So we'll move on to our health vacancy report. We'll give way to Dr. Jenkins.
Thank you so much, Mr. Chair. You have received the vacancy report for the month of December and the month of January. Proud to report that we continue to see a drop in our vacancy rate. I think we went from most recently 12.2 to about 11.2. I continue to be impressed by the leadership of the health department, certainly knowing that there's value in having positions filled. And of course, we tend to have some individuals who go on to greener pastures, but we wish them well, but that has been few and far between. But Mr. Chair, happy to answer any questions the board may have about the vacancy report.
All right. We have any questions, board? Yeah, it looks like we are trending down on a regular basis, so we'll hopefully continue to see that occurring. We'll ready ourselves for the NOV, the health NOV report, as Mr. Salter usually takes care of that area.
Yes, sir. Nothing earth-shattering to report here. We did have actually a positive month in December where we were able to get 5 NOVs in compliance and not add any new ones. January was a wash. We added one and got one off. So we're still plugging away, but we'll take that ratio anytime.
Absolutely. All right, board, do we have any questions about our NOV report for December and January? All right, moving on to the health director's report.
Thank you again, Mr. Chair.
Yes,
you
sir.
have received the health director's report. It's always refreshing to be doing the work of public health, but then when it's on paper for your presentation, it's just that much more fulfilling. I will not tarry with you long. Thank you all for hanging in there. Just of course, highlighting our dental program under the leadership of Jim Harris. They are cross-training, and a lot of our dental assistants are taking advantage of professional development opportunities, but more importantly, they're doing a lot within our dental program to enhance it. So we have that. We're not going into detail about the community linkages of care. We just heard a very good presentation by Mr. Jason Smith about that, but I certainly want to bring your attention to our health education community transformation Family Matters, Durham. ICO for MCH is a grant that we get on a cyclical basis, and they thought it not robbery to change the name to be more inclusive of the entire family spectrum. So that's something that we're certainly proud of under the leadership of Lindsay Bickers-Bach and Dennis Hamlet. With that, they are doing a lot of things to really emphasize preconception health, and they're doing a fantastic job. So they continue to be the stars of the counties within the state system. So again, that's indicative of us continuing to receive that funding. Last but not least, with COVID dissipating, we're starting to see a lot more partnerships internally with public health. So that partnership between the nutrition division and health education, particularly the tobacco managerial position, is phenomenal. We did have Becky Posada, who's a nutritionist, a wonderful human being, who was able to participate in our Leadership Academy sponsored by the county. And her project, or their project, I should say, was all about re-emphasizing or reintroducing our smoke-free grounds throughout Durham. And then once that project was overboard, she thought it not robbery to extend it and to have some activities to include our health education team. So again, the work continues to go well. Happy to answer any questions about the health director's report.
All right, I don't see any hands, Dr. Jenkins, so thank you for that report. We'll move on. I don't see any committee reports. We don't have any committee reports, no old business on the agenda. We do have 2 budget ratifications and 4 budget amendments, and I'll let Dr. Jenkins, I'll let you have the floor to present those items.
Thank you again. I'll be really brief. The 2 ratifications for the board's consideration: budget ordinance amendment to recognize $15,000 from Duke University's Division of Community Health. These funds will be used by the Durham County Department of Public Health to cover costs involved with conducting the 2026 Durham County Community Health Needs Assessment Survey with its residents. As I've said to this board so many times, under the leadership of Marissa Mortarboy and Bria Miller, we have an award-winning process that is the star of the state. Those words came directly from Kathy Dale, who runs the Community Health Needs Assessment Program for the state. The second budget amendment ratification, the board is requested to approve the Department of Public Health's administrative write-off in the amount of $996,162.75 in uncollected debt from 2 electronic health record systems that are no longer in use. We migrated from Patagonia to Epic back in 2021. Dentrix was the department's dental EHR from 2009 to 2021, and they are no longer in use. To maintain those programs is very cost prohibitive, and this is a measure to really be a little bit more efficient. We do have that amount may kind of take you back a little bit, but I just want you all to understand those are amounts that are over multiple years. And the plan is to send it to the state's debt set-off in order to recoup those funds. So those are the 2 ratifications. Mr. Chair, I'll go into the amendments. First, budget amendment, budget ordinance to recognize $26,250 from the Communicable Disease Branch of the North Carolina Department of Health and Human Services. Again, these funds are going to be used for our integrated targeted testing service grant provided through our CD branch of the North Carolina Department of Health and Human Services. They are adding an additional $26,250, and these funds are used for HIV testing, particularly in the jail. The second ratification, budget ordinance amendment to recognize $9,375 from the North Carolina Association of Public Health Agencies for the community co-leadership in the Healing Centered Engagement Program of Thriving Hearts. These funds are going to be providing the Thriving Hearts grant to the local health department to authorize work under this grant. Those funds are going to be used for our ACEs work. We're so delighted to have Jess Bosquet Rhodes, who is our ACEs coordinator, and she does fantastic work. She's lending her expertise to this initiative. Thriving Hearts is a maternal child health initiative for a 10-county initiative, and we're happy to be a part of it. Of course, maternal child health and infant mortality continues to be one of those areas that we are focused on strategically. And then we have the third, which is budget ordinance amendment to approve multi-year interlocal agreement between the Department of Public Health and Durham Parks and Rec. We desire to work collaboratively in support of their mission by providing joint program services that promote a holistic health and wellness to Durham residents. So that's a interlocal agreement that allows us to continue that great work with Durham Parks and Recs. Finally, budget ordinance amendment to approve $7,000 awarded from the Community Engagement Research Institute subcommittee of the Duke Clinical and Translational Science Institute to implement the Advancing Health Equity Together through Education Outreach Grant Program. This $7,000 is going to be used to help to reinvigorate or restart cancer support groups, both breast cancer and prostate cancer support groups through a strategic planning process. Those are the ratifications and amendments for your consideration, Mr. Chair.
Thank you, Dr. Jenkins. So let's take this in smaller bits. I'll entertain a motion at this time to accept the budget ratifications, the 2 ratifications that Dr. Jenkins presented.
Just a question real quick. I see
Go ahead, I'm
Anthony, you have
sorry.
your hand up.
Oh, thank you.
Go
I
ahead.
just before we ratify, I just wanted to ask a question, Director Jenkins, for the write-off for those two EMR systems. Is it mostly from operational expenses of those EMRs, or is it more from like the patient billing side that we're not able to collect the debts?
Certainly from the patient billing side. Thank you for the question, Mr. Gregorio. All efforts on our part from the Department of Public Health have been exhausted in an effort to collect those funds. As you would imagine, they do collect and they build up over the years. So that is pretty much why we are seeking to write them off. So hope that answers your question.
Sure. And these patients, are they mostly self-pay?
Yes.
Yeah. Okay. Thank you.
Director Jenkins, I felt like last month or previously, we discussed a large write-off.
That's it.
Is this the same one or different? Is this just now us approving it?
This is the same one, and this is just you approving it, Vice Chair Ray.
Okay. I think maybe before did we identify it and discuss it, and now we're approving it. Is that right?
Yes, sir.
Okay. Got it. Perfect. Thank you.
Absolutely.
All right. Any other questions? All right. So if I'll entertain a motion to accept the two ratifications.
Motion.
I heard two motions. So we'll take
Second.
Dr. Ray's motion and Mr. Gregorio's second. And if there's no further debate, we're ready for the vote. Donna?
Sure. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio,
Yes.
Dr. Jackson,
Yes.
Dr. Miller, Dr. Orto,
Yes.
Ms. Silberman,
Yes.
Commissioner Valentine.
Yes.
Thank you.
All right. And we'll entertain a motion for the to accept the four budget amendments.
Motion.
Second.
All right, it has been moved and properly seconded again. If there's no debate, we're ready for the vote. Donna?
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio,
Yes.
Dr. Jackson,
Yes.
Dr. Miller, Dr. Orto,
Yes.
Ms. Silberman,
Yes.
Commissioner Valentine.
Yes.
Thank you.
All right, thank you. Next we have, we'll get your input for any agenda items for our next meeting, which will be on April the 10th of this year. Any suggestions for presentations?
Dr. McDougall, I certainly, by that time, we probably will have some activity to report on as far as impacts from any potential cuts. And I certainly want myself and Finance Administrator Micah Gwendon to keep this board abreast. So that's certainly one thing that we'd like to provide an update on, just to keep you in the loop.
Thank you. It's been a little while since we've had any discussion about the lead abatement process in our parks. Perhaps we could get an update on that at the April meeting.
More than happy to provide that for you, sir.
Thank you. Anything else? Any other suggestion from our board? All right. Well, we'll leave the rest to Dr. Jenkins and his very capable staff to come up with a full agenda for the April meeting. We have an opportunity for some informal discussion. If our board or
Mr.
staff-
Chair.
Yes.
Ms. Gwendon says we need to vote on the FY26 budget, I believe.
Oh, okay. Thank you. I didn't see that in the chat.
Yeah, so we'll make sure we present that to you as well.
Oh, okay. On the okay.
Oh,
I was gonna say
so that's next time.
not
is when we
to,
need to
not
vote.
tonight.
Okay, that's for
Just
next agenda.
presentation.
Got it.
Gotcha. So that'll be in the April presentation as well. All right, very good. April agenda. I'm sorry. All right, so any informal discussion? You folks look like you're ready to discuss what happens after the meeting.
Well, I will just say, public health is certainly in a difficult position today across our country and across our world. And I just want to say thank you to all of you for doing what you do. And please let us know, as the board that supports you, if we can help in any way. Because the funding for what you do is essential, and we want to do what we can to support you.
We appreciate that. This board is fantastic, and it feels great to have your support. Rest assured that we will keep you abreast of any significant updates that require your attention. But for right now, we are truly inside a wait and see type posture, but we are certainly on the ready.
All right. Well, I will entertain one final motion for this evening, and that is to adjourn.
Motion to adjourn.
Second.
All right, it has been moved and properly seconded. Donna, we are ready for the question.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio,
Yes.
Dr. Jackson,
Yes.
Dr. Miller, Dr. Orto,
Yes.
Ms. Silberman,
Yes.
Commissioner Valentine.
Yes.
Thank you.
All right, folks, we'll see you all hopefully in April. Have a good evening. Thank you for joining.
Bye.
Thank you. Take care.